Namaste, I'm Dr. Siri, fertility expert with more than 15 years of experience practicing at Sai Karuna Fertility and Maternity Center, Nagarbavi, Bangalore. So, there are many protocols in IVF stimulation, saying the short protocol, the long protocol, and there's antagonist protocol, and many such protocols. But most commonly, most of the clinicians prefer to go ahead with antagonist protocol as the first method of stimulation in any patient who walks in, because it is easy, it is comfortable for the patient as well as the clinician, and it's a very short duration stimulation that happens. So it is the antagonist cycle that everybody prefers to stimulate, and generally it starts from the period 2nd or the 3rd day, where the hormone injections are given daily for about 9 to 10 days until when the follicles are ready. When I say ready, we want at least 2 or 3 follicles which are more than 17 to 18 mm. That is when an injection called HCG or HCG is given, or Lupride is given, which will give the final maturation to those eggs. And later, 36 hours later, the eggs are aspirated from those follicles under anesthesia, and these eggs in the lab are further fertilized with the use of the sperms, and then they might be frozen or would be transferred either on the 3rd day or on the 5th day. So when we transfer the embryos on 5th day, those embryos are called blastocysts, or on the 3rd day they are in the 8-cell stage. So they are the 8-cell stage embryos that are transferred on the 3rd day. Post transfer, for about 15 days, we would give medications as a luteal support. The luteal support could be in the form of a gel, capsule, injections, in whatever form the clinician wants or is comfortable with, is given to the patient. And the next 15 days, nothing will be done, and then post 15 days, a blood test called beta HCG will be done to test for the pregnancy. No need of any bed rest or any particular diet to be followed. Staying healthy and active helps.